Welcome back to Navigating Cancer. I'm Dr. Joey Bennett along with Wendy Hall. Again, thank you very much for tuning in to today's show. And we're talking about pain, and talking about pain mainly from how it relates to cancer patients. But as we were talking about in the first segment, a lot of times diabetics can experience the exact same pain. People who have had traumatic injuries, maybe lost a limb, can have the same type of pain. People who have had surgery done to the chest can have the same kind of pain. And when we closed out the last segment, we were talking about the psychological effects of pain. And I mean, this is something you deal with every single day, about what kind of problem it plays on someone emotionally and psychologically when they're in pain.
That's true, and I think I see this more in chronic situations, chronic pain, you know, that is not really related to our cancer patients, but it's something that people underrate. They don't realize that it's involved, and the things that you would do for that are the things that you would do for depression and anxiety as well. And that's, you know, talk therapy as well as sometimes some medication.
And I mean, you know, a lot of times we're not talking about just pain medications. There are several drugs in the antidepressant category that can help with pain as well. Sometimes you have to add that to other things, but you know, as Wendy was saying, especially for people with chronic pain, if this is something you're living with every day of your life, part of it is mentally being able to adjust and handle.
It's very challenging,
situation.
and they don't realize how draining it is for them.
Correct. Another thing that's unique about pain is it actually can affect your immune system. There have been studies that have shown that people who have chronic type pain or severe pain will have a decrease in what we call the natural killer cell counts. These are white blood cells that are out there trying to fight infection. And so if you're in this chronic pain situation, you're literally also going to put yourself at risk for infections and not be able to heal things as quickly as you normally would. One of the things that becomes very difficult sometimes is, you know, what does pain mean to a patient? And there are a lot of different things. One, if a patient is having a lot of pain, they often feel like their prognosis is very poor, or that, you know, they may even be facing death, particularly when their pain gets worse. I mean, if the pain gets worse, they immediately wonder, why are things going bad? The second thing that you tend to see is that there is a decrease in their autonomy. I mean, they're unable very often to do the things that they want to do physically. They quit functioning socially. They stop going out and eating with friends. They stop playing tennis. They stop playing golf. They quit going to bridge and things of this nature. And you want to try to make sure that someone is able to maintain their normal quality of life. Other thing that ties into it is just a decrease in the enjoyment and their quality of life that we just talked about. And a big one that we deal with is a challenge to their dignity. I mean, a lot of people feel like, you know, it's not dignified to be sitting here having somebody having to take care of me. How often do we have our patients come in with their family members and they're sitting here saying, you know, my son or my daughter is now taking care of me, and that's just not the way it's supposed to be.
Right.
And so it's a difficult thing, and it's something you work with very well, to try to let them know that sometimes you have to let go and let someone help take care of you because they want to take care of you.
That's true. And then in some family or friend situations, there's misunderstandings about the reality of pain and changes in the relationship because of that.
Right. Now, when you start looking at pain, the first thing to do is, you know, you want to assess the pain. I talked in the first segment about the different types of pain. So the first thing that I always say is the most important is ask the patient what their pain is like. How often are you having it? How severe is it? What type of pain is it? Is it a dull pain, a stabbing pain, a shooting pain? It really helps us to try to decide how we're going to approach the management of that pain. The second thing we often have to do is dispel the myths and understandings that are related to narcotics. Way too often I hear someone say, I don't want to take morphine, I don't want to take codeine because, one, I may get addicted, or two, you know, everybody I've ever known who took morphine died within weeks. That is not the case. These drugs, when we use them for cancer patients, are usually not addictive. Patients will get off of them if they don't need them, and it does not mean that someone is approaching the end of their life. I mean, it really is the best way to approach the management of pain. The biggest thing that you have to do is you have to believe the patient. We do not have a machine that we can hook up to a patient like we do for blood pressure and like we do to see how much oxygen you've got circulating in your system. You know, there's not an electrical system for me to hook up to you and say your pain is a 9 on a scale of 10. The only person that can tell you that is the patient. Sometimes you can get some visual clues by looking at their facial expressions and how they're moving. But at least in my experience, you have to trust the patient to be telling you what they're feeling and then use that patient's input to tell you how much progress you're making as you're addressing their pain. The next thing to do is when you start treating somebody, you assess and you reassess and you reassess and you reassess. I mean, once you start getting some improvement in the pain, you decide, can I do better? Do you need more improvement? Let's go up on the dose. Let's add another medication to it. So it's not like you can throw one pill at somebody and walk away and think that they're going to be perfect with that. Make sure that you're also dealing with somebody who understands what you're trying to do, because some of these medications and the dosages and the schedules can be a little bit complicated. So we try very hard to make sure that we write down and outline the way that we want to use the medications, understand what the side effects are associated with the medications, and proactively actually try to remedy the side effects before they even come up. One of the perfect examples, constipation. Anytime you take a narcotic, you're going to have constipation. No one should take a narcotic without also taking some sort of a stool softener or a laxative at the same time. So those are things that we look at. Again, we want to know how intense it is. We want to know what makes it worse, what makes it better, and we make sure that everybody understands the side effects, like I said. And finally, you have to include the entire family, because way too often we'll have a family member call us saying, my mother is in terrible pain, help her. And what I will do is I'll prescribe a medication and I'm going to try to get rid of that pain as fast as I can. 2 or 3 times a month, I'll get a phone call the next day saying that mom went to sleep last night at 9 o'clock and it's 11 o'clock today and she's still in there sleeping. What are we doing? And it's kind of like, we're getting rid of the pain. Let mama sleep because she's tired, her body needs the rest. But over time, that sleepy effect that you may get from some of these narcotics will wear off. It will actually go away, and it can take sometimes 3 to 4 days, but very often people will sit here and say, I think we're giving too much. The next thing we want to look at is, where is the pain originating? What is the quality of the pain? Like I said beforehand, how severe is it? How long have you had this pain? Is there something that aggravates it or makes it better? Because that will actually allow us to know what might be causing the pain.
And is it to be expected?
Correct.
Which you always know.
And sometimes, just positional changes or physical therapy can make it better. So there's lots of questions that we ask to try to find out the best way to treat it. And when we come back, we're actually going to talk about the drugs that we use for pain management.